Hello, my name is Tracy Cox and I'm the Chief Executive of Bath and North East Somerset, Swindon and Wiltshire CCG. Now, whilst the annual general meeting is usually an opportunity to look back at the previous year, you will be aware that due to the coronavirus pandemic, it has meant that the last 6 months have been an unprecedented and challenging time for our country and for the health service. The 3 predecessor clinical commissioning groups were just at the point of merging when the pandemic hit us. But thankfully that meant that we were able to use the skills, capabilities and capacity of all 3 CCGs to help with our response. We would like to use this video to share with you some of the amazing things that our staff did in response to the pandemic. As always, our staff have been fantastic and they really stepped up to the challenge. I hope you will enjoy watching.
Hi, my name is Lee Rockingham and I'm the Public Engagement Officer for BSW. During the height of the Covid-19 pandemic, I was on secondment to the Medicines Management Optimisation team, where I ran a scheme to enable vulnerable patients who were shielding to still have their end-of-life medications delivered to them directly to their door. In order to do this, we needed the help from volunteers from across BSW, so staff from the CCG gave up their time and put their efforts into being coordinated by myself and other people around BSW to go to pharmacies within the local area, collect their medications and then distribute them directly to the patient's door. Without the efforts of the staff across BSW, we would never have been able to get this service off the ground, and it's thanks to their tireless efforts that we were successful in our endeavour. That's my COVID story.
Hi, I'm Wendy BRUNO. I'm the Primary Care Manager for the Swindon locality. My COVID response role has been as the PPE Manager for the BSW. We've been operating out of the PS unit building in Swindon in a small warehouse, receiving in stock to get out to our GP practices, but also supporting our wider health and social care communities right down to personal health budgets. This has been a rewarding and challenging role, and it's really good to see that we're making a difference.
Hi, my name's Helen Harris. I work for the quality team as a quality manager in the CCG. Back in April, when coronavirus hit, I was redeployed to the community nursing team in Bath and North East Somerset to support them with their caseload, as they were short-staffed due to shielding. I stayed with them for 10 weeks, providing nursing care to people in the community of Bath, when returned to my substantive role in June.
Hello, my name is Kim Grimmer and I'm the practice nurse lead for BSW Training Hub. During the COVID pandemic, I was seconded to Chippenham, Corsham and Box PCN, where the focus of my work was to offer training to all the care homes across the PCN on taking physical observations. So that's temperature, pulse, a blood pressure, respiratory rate and oxygen saturations. This can be really crucial when handing over an unwell patient to a clinician in general practice. We also took the opportunity to introduce a communication tool that enabled carers to gather and to systematically hand over information, including the observations, about an unwell resident to a clinician in general practice. I'm really pleased to say that we were able to deliver this training to over 60 carers and that all the care homes across the PCN are now using the communication tool.
Hello, I'm Helen McNair. I'm an individual commissioning coordinator working in continuing healthcare department of the Wiltshire locality for BSW CCG. During the early part of the pandemic, I was redeployed to a hospital discharge support unit caring for patients that had been recently diagnosed and treated with coronavirus. Part of the challenge of that was working 12-hour shifts and sometimes in full PPE, and that is me in there somewhere. Also, it was very challenging to ensure that our patients stayed connected to their family and friends during long periods of isolation, and so getting to grips with social media platforms was also quite interesting. And that's my COVID story. Thank you.
Hi, my name's ALISON Tucker and I'm an individual commissioning coordinator working within the continuing healthcare team. During the COVID-19 lockdown, I was redeployed to one of the hospital discharge support units, and it was a real privilege to be working clinically again with patients. It was a great opportunity to really be able to make a difference to some of those people's lives who, when they'd gone into hospital, their families thought that they may never see them again, and they weren't able to visit them when they were in hospital and really quite unwell. So when they came to us, we could make just a few small differences that really affected the patients, and as well as caring for them and getting them well, and all the patients that we looked after did go home, so that was fantastic. We were also able to facilitate them seeing their families, firstly through things like video conferencing, and then through the windows of the unit, and then eventually they were able to meet in the garden but just before they were discharged. And it was just a great thing to see those families and the difference that it made to them. So I think the biggest thing that we learned by doing that was about how important communication is to all our community, especially in these really difficult times. Thank you.
Hello, my name is John and I work as a repeat prescription coordinator for the Wiltshire pod for BSW CCG. The biggest change for me during the pandemic has been going from an all office-based team with pharmacist support to an all remote team, and being able to change and adapt and overcome those challenges while working on a remote basis and still providing the same level of service to our patients.
Hi, I'm BRYNN. I'm a GP and locality clinical chair for Baines as part of BSW CCG. Primary care was extremely responsive in adapting new ways of working around infection control, digital and triage models. And now we're learning to get back to normal care, normal levels of demand, and manage that alongside living with COVID represents a big challenge going forward. There has obviously been challenge around patient care as well that we have learnt to mitigate as best as possible, not least safeguarding, but also using examination and face-to-face assessments to gather a better understanding of what to do as the next step with patients. So plenty of challenges, but primary care has embraced these very effectively.
Working together to stay alert, control the virus and save lives.